My name is Belinda Addo, and I've been a practicing nurse practitioner in the family practice and urgent care setting for the past 5 years. In my current setting, we see a variety of diseases and comorbidities that can be challenging to diagnose and treat. One of the most common health conditions that we see on average has to do with some form of sleep disorder or insomnia. Amongst sleep disorders, insomnia is widely prevalent, and the disorder has been reported to affect up to 33% of the adult population. Some researchers estimate that the global prevalence of insomnia has become even higher, perhaps as high as 50% to 60% in some cases. Insomnia is considered the most common sleep disorder. It's often associated with poor sleep habits, lack of exercise, anxiety and depression, chronic illness, and certain medications. Symptoms may vary, such as falling asleep or staying asleep, feeling well rested, and for some, it can be acute or a chronic diagnosis. In the past 20 years, there's been an increase of this diagnosis, and most often used with some type of prescription medication for treatment. Despite the prevalence, it's received scant clinical attention. And moreover, there are lots of misconceptions and myths about sleep and the prevalence among them and seeking professional help. The focus of my CSP is to discuss the relevant literature concerning the prevalence of insomnia amongst American adults, as well as review current treatment models while focusing on the healthcare costs. For this CSP project, it's important for us to identify who are our stakeholders. Our stakeholders include our patients, who are our subjects, the ones that are going to be learning different techniques and ways to help improve their sleep hygiene, to address their insomnia issues, as well as their family. Their family are stakeholders in that they provide support and assistance in helping the patients be able to manage their treatment and support them as they embark on this journey, followed by our providers. Our providers include doctors, nurse practitioners, or specialists. They are integral in implementing. They are also our healthcare coaches that not only educate, but support and offer referrals if needed, given the process. And lastly, our unidentified stakeholders are our healthcare insurance. This is guided by the support of the whole process and also, if need be, other support services to help implement the CSP. The theoretical framework for this CSP comes from Lydia Hall. Her framework is known as the 3 Cs, which look at the core, care, and cure. Her theory contains independent but interconnected circles. The core is the patient to whom nursing care is directed. The core has set goals by himself or herself rather than by the healthcare provider or family and friends. The core makes the decisions and behaves accordingly to his or her own feelings and values. The cure is the attention given by the patient, by the nurse, and other medical professionals. In this model, the focus of care is not only on the nurse, but on the healthcare professionals involved in the care of the patient. The cure includes interventions or actions geared towards treating patients at whatever illness, disease, or disability she may be suffering from. The care circle, as Hall explains, is the role where nurses are in the model. According to this theory, the nurses are focused on performing the noble task of nurturing the patient. It speaks to the motherly nature of nursing, which may include a nurse addressing the patient's comfort issues. The role of nursing also includes educating patients as well as helping patients meet their needs if they're unable to meet them alone. This CSP project is largely designed to help with sleep hygiene and sleep tracking. As we know, many times with insomnia, patients are often treated with medications, and the interventions need to be put in place that don't require medications are often foregone for various reasons. So, the goal of this project is to help. First, we'd like to help each patient have their own individualized plan that tackles what are some of their issues that they're having when it comes to sleep. We'll offer group sessions for various discussions, various methods that other patients have used, or other strategies that they have developed that help them address their issues with sleep. Patient education handouts that offer resources for sleep relaxation techniques and a variety of other sources. Will offer pre and post utilization, discussions about sleep activity before and after. We will also use and engage in the sleep cycle mobile application that can be used on iOS and Android phones to help tackle and address sleep challenges. This will help patients track and monitor their sleep, whether or not they're getting sufficient, adequate amounts of sleep, and the various degrees of sleep. And lastly, the goal of these sleeping interventions is to help patients address their sleep hygiene and the things that they can do to assist themselves in having restful nights without medication. The value for this CSP for each stakeholder is different and varies. For the patient, the goal is for them to increase their welfare and overall health as a result of using the CSP with the education and assistance of the model provided. For family, their involvement or their educational piece is the success of their family member to provide support. For the provider, their education relies on providing good leadership as well as creating learning outcomes to help patients become successful. And then, most importantly, the health insurance plan overall, their investment is to help reduce expenditures. Patients will be updated with their project and their success through a virtual website where they're able to track and monitor their sleep cycle application as well as their educational classes and then be able to have a check-in. This allows for patients to be able to facilitate involvement that increases their participation virtually and physically, that enables them to be able to do things at their own pace, which is important for their success. Stakeholders have various needs and responsibilities, and as a result, their needs vary. For example, patients. Patients require stakeholders such as patients value